fighting for this badge of honor of being able to say, I'm a doctor or I have a white coat.
Dr. Ashley Denmark is a board-certified family medicine doctor and the founder of Project Diversify Medicine, a digital community where she helps minority students make a path for pre-med or medical school.
We're not just fighting for this badge of honor of being able to say, I'm a doctor or I have a white coat, but we're fighting to heal our community.
In California, UC Davis Medical School could be a model for what post-affirmative action med school admissions could look like. It's ranked the third most diverse medical school in the country, and they haven't used characteristics like race or gender for decades.
Qualities that will make a good physician are ultimately those things that allow patients to connect better and believe their doctors and have a trust in their doctor's abilities.
Some California history here. In 1996, voters approved a law which banned affirmative action practices in public employment, education, and contracting. Students at several state universities staged walkouts and protests. The next year, nearly 200 Black aspiring doctors applied to the University of San Diego. Not one was accepted. Research showed in the decade following the ban, medical schools saw a drop in applications from underrepresented students of color. Cut to 2006, UC Davis admissions shifted to looking at how an applicant's background could help treat the communities they're from and combat health workforce shortages.
If you're poor, if you live in a rural county where your nearest emergency room is more than maybe 50 to 100 miles away, it is possible for you to become a physician and have the training to go back and serve the community that you love and are passionate about working in.
Items like location, resiliency, ethical values, and the ability to listen are weighed. The school still requires certain courses and the Medical College Admission Test, or MCAT, and this year they've begun requiring a professional readiness test that grades cultural competency, social skills, and reliability. The model has worked. In 2020, half of their med students were from a group underrepresented in medicine. The school says more work needs to be done, and Dr. Denmark agrees, but they're both optimistic.
I encourage everyone to really strive to continue their journeys and not give up and realize the bigger picture, that we're healing generations of our history and our families.
The medical school has also done plenty more. We're talking $12 million in scholarships, programs, and accelerated paths to do things like encourage diverse applicants for family doctors and for those who want to practice in rural or tribal communities as well as inner cities. Lindsay Thies, Scripps News, San Francisco.